Vice Mayor, members of council, the Suffolk Health Department and the city staff continues to work together to improve efforts in meeting the needs of our citizens during this pandemic. Tonight's COVID-19 update is to be a two-part presentation given by Dr. Lauren James, Interim Director of the Western Tidewater Health District, and followed by Deputy Chief Spicer. At this time, I would like to call Dr. James to the podium for the initial part of the presentation. Thank you.
Good evening, Honorable Mayor and Honorable Council members. So I will be doing the COVID update this evening. First slide, please. All right, so this is our pandemic dashboard. So I'm just gonna start with the overview of what COVID numbers look like in our district. We have about 75 new cases a day on average. Our percent positivity is 17% at this time, and the state percent positivity is 11%, and that reflects the amount of positive tests out of all the testing. And the next metric shows outbreaks. So our outbreaks are steady, so that is good. And the last metric reflects cases in our healthcare workers, which is also decreasing. So that's a metric that we look at to make sure that our staff that are working in long-term care facilities, hospitals, nurses, things like that, are in good condition, because in the event of a continued surge, we want to know that their cases are under control. All right, next slide, please. Now that our vaccines are here, what are we using? The U.S. currently has 2 vaccines that have been approved through the EUA approval, that is Emergency Usage Authorization. Those are Pfizer and Moderna. Our district is using Moderna. It is mRNA-based, 2 doses, 28 days apart. It does not require specialty equipment for storage. Pfizer, also an equal and just as effective vaccine, does require the ultra cold freezers. These have been on back order since December, but we are working to get some and hope to be able to acquire some in the next month, if not this month. Next slide, please. I think I went over this slide last time, but it's always good to cover. Why are we pushing vaccination? Vaccinations are our best tool to fighting disease and illness. Vaccines reduce the number of susceptible individuals in the population, prevents morbidity and mortality due to illness, reduces transmission through herd immunity. So what is herd immunity? Herd immunity is when we achieve immunization of 1/3 of the population. So let's say our community is 100,000 people. That would be 33,000 people. So that is our goal, to eventually get 1/3 of the community vaccinated. Next slide, please. All right, Health Department services. So last March, in an effort to keep citizens safer, we transitioned some staff to telework, but the majority of our staff have continued to work on site. The Health Department did stop in-person appointments at that time, similar to other facilities in the Eastern region. The Health Department will be resuming 1 day per week in-person services at the Suffolk Health Department this month. Before COVID, we only offered 2 days a week at the Suffolk site. Since this is a district that contains 4 localities, we actually have 1 nurse practitioner that covers all 4 of these districts. That is what the funding supports. So we are doing our best. We will be providing a weekly vaccination event targeted to vulnerable populations, specifically our seniors, which we have seen have been the hardest impacted by COVID. First event was last Friday. We vaccinated 120 seniors. All of our departments, WIC, Environmental Health, and Nursing, are still and have been accessible. Next slide, please. City distribution plan. Allocations are determined by the state, not the district. Recently, they changed to a population-based allocation. The Western Tidewater Health District is about 2% of the Virginia population, and the Suffolk Health District is about 1.2% of the Virginia population. Group 1A, what does that include? That was our first group that we started with, December 28th. Those were our healthcare providers and long-term care facility residents and staff. January 20th, around that week, we made a press release saying that we were moving into Group 1B. What does that include? Our frontline staff, police, corrections, daycares, schools, food and agriculture, manufacturing, grocery store staff, public transit workers, mail carriers, city officials, citizens 16 to 64 with major chronic illness, and 65 and up. A recent statement today was shared that in Virginia, Group 1B is 60% of the population. So this is a large, large group, and it will take months across the state to move through this group. So who can vaccinate? Who are our partners? Hospitals, health departments, pharmacies, local providers. I will share that Suffolk also partners with community providers and pharmacies so that they can distribute. Something we've seen with our seniors is that those who aren't as mobile feel more comfortable getting it in their pharmacies and with local providers, and that could be with anyone. So we do try to make sure they have allocations when available as well. And so, as I stated, the Suffolk Health Department will have a weekly vaccination event that does target seniors, and once our allocations are increased, we will be able to do more. The plans are in place, so we are in a good position, and as soon as we get more, we will do more. Next slide, please. What's next? At the end of the month, we will be moving to a new registration tool. So this is a VDH mandate just to keep us all united. It is a better tool, it is easier accessible, but it has created a delay in how the public can register because this transition has just kind of created a kink in the system. But we are working through that. Communication plan, we do see this as a major point of improvement on our part. We are aware that the public, needs better access to us. And in that same vein, we are working on updating our website. We do not have anyone on staff for our health department who does IT, but we have reached out to our central office and they are supporting us. We plan to update our website to have more relevant and helpful information. We are working on that currently. Also, within communication, the city of Suffolk is supporting us to have a call center where our citizens can call in and get information and resources. I know on some local sites, there is a survey link. And most health departments who have this survey link, this is just collecting information. It is not a way to access an appointment. We call it a pre-registration pool. So what these links do is collect their information and put them on a waiting list. So that can be an option for our website as well, or we can continue to have people schedule through the hotline. So once allocations increase statewide, we're gonna ramp up our services and be able to do more. This is a marathon, not a sprint. All right, next slide, please. So this is just the last slide. This is just overviewing. We're currently in phase 1 of our vaccination, so that is where we focus on our priority groups, our most vulnerable citizens and our frontline care workers. And if you see in red, that's where we are now. Our vaccinations are limited because we don't have that many in production. But we hope to eventually move to phase 2, where we have more available. And then the last phase is phase 3, where the COVID vaccine is just like our flu vaccines. They're at your primary care, they're at your urgent care, they're at the tip of your fingers. So we really hope to be in phase 3 by the summer. That's being optimistic. But that is all I have, and I will take any questions.
Councilman Johnson.
My question is real easy, Dr. Jane. Thank you for being here, by the way. I want a phone number. I had two 80-year-olds call me today and said, how can we get in line to get it? This is true. And I couldn't really tell them because they tried the phone number over and over. Is there any way, particularly people that aren't computer savvy, oh, that's wonderful, but these older people need a phone number. And then to be told, when are the lines going to open back up?
So we are working with the city on a hotline. And the health department call center it's not a call center, their line is open, the Suffolk Health Department.
What's that number?
I don't know.
Oh, I'm sorry.
I'm sorry, I don't know.
I thought there was a magic number.
No, sir.
The number that's over there is 514-4781. 514-4781. I have it memorized.
That's funny.
But, to let those citizens know that it might be a wait, so I'll give an example. I'm pretty sure the clinic we had last week for seniors, if that's the citizens that we were talking about,
right,
they were able to call and make those appointments, but it's only 120 appointments.
Right.
So as soon as those open up, we'll be able to do.
But you have another one coming up this Friday, the same,
sir. It'll
same
be-
120? And then, but when can they start? The next one will be when, maybe?
I think it's going to be every Friday. Is that what?
Okay, is that what it's going to be?
So I would, say the day before.
And what would you advise these people that are calling and not getting through? Just to keep calling?
Yeah, and
Sadly.
be patient with us because it's tens of thousands of people waiting.
Yeah. How about, the other question I had was pharmacy-wise. Do you know what pharmacies in Suffolk? I know, one of the pharmacies is doing it, but they're not doing it in Suffolk.
Oh, I think it's, I would say they should check with whatever pharmacy they are usually getting their medications from.
Right.
But to my knowledge, we are planned to partner with CVS, Harris Teeter, and what's the other one? I'm missing somebody.
Rite Aid or Walgreens?
Walmart. But the issue is they have to vaccinate their own staff first, and then they're going to offer it to the public. So wherever they pick up their medicines, because that might be more comfortable. And there's several practices that we're partnering. Bayview.
Bayview's doing it.
I know
too.
Bayview's doing a lot.
Is Centera yet?
So I do think Centera and Norfolk General, but I haven't heard of like Obacy and our Centeras in Suffolk doing like a mass vaccination. I haven't heard of that yet.
Well, the population is just desperate for information. That's what, and we're all running into the same thing. But thank you. We appreciate, and we know it's a huge undertaking. But quicker. We need quick. Thank you. Thank you.
All right. Yes, sir.
Thank you. Thank you, Dr. Jane, for your presentation. And I know that you came into Suffolk at a bad time, and I admire you and thank you for doing that. I think Suffolk has sort of dropped the ball where they should have had a deputy system person, doctor, but you are trying to cover such a large area, and I know you're only one person, and you only can put out the number of shots that you receive for the localities. So I feel sorry for you with all the pressure that you are getting.
Empathy. Thank you.
Because I know what it's like, because we are getting it as well as far as calls, and I know you are getting it a whole lot more. But I feel sorry for you with the amount of responsibility that you have to cover. And so do you have any way of knowing yet whether or not we will have drive-in where the seniors or people can come without appointments?
I will say that Suffolk is in a good position, and as soon as we get in, I'm very optimistic that the allocations have to improve. So we've just maximized our distribution. So if you look at one site, the VDH site said that Suffolk's already done 6,855 vaccinations. That's a good number based on our population. That's not even the whole district. But to your point, once the state is giving us more, those plans are already in place to make it more accessible, and whether that's at a community site or drive-in, they already have a good amount of plans for those.
The other thing, isn't it true that the state is giving the vaccines out according to the population? Is that true?
Yes.
So therefore, where did that make Suffolk fall in the line with?
So 1%, so the more density you have in population, the more you'll get. And out of the 1.2% we get for Suffolk, we try to, as much as possible, distribute it to get to vulnerable populations, and then as well as that 1B, our the group that I listed. So we try to kind of split it as much as possible between the two.
Last comment, and I know, Mayor, I'm taking a lot of time with this one, but on the senior population and the African American population, look like their numbers are down, way down with the number that's being able to get the vaccination. Because I have a lot of African Americans that's calling me saying we can't get it, we can't get it, we can't get it. So I'm just trying to figure out how we can get more in our neighborhoods that people actually have problems getting online or trying to get the shot, get the vaccine. So
I think, just one solution, and that's not the only solution, but as we are able to partner with churches in the community, so maybe the health department isn't as easily, well, I guess it's not super accessible by phone right now, but, you know, we have to have other venues. I think that's what you're saying, to reach all ethnic groups.
Right.
Because that's a vulnerable population as well as far as deaths of COVID. So I appreciate your point, and we'll include that in our plans. Thank you.
And thank you again for
Thank
being
you.
so patient.
Goldberg?
Mr. Mayor, just to deviate a little bit from this, I'm not here to embarrass you at all, Ms. James, Dr. James, is that her father and I have been friends for many, many years, and I remember when she was born, and she has been just a delight, and I'm so glad. I didn't know this until tonight, and I'm so proud of you, because I remember when you were born, and you've become this doctor and a big help to the community, so I thank you for it and appreciate you doing that, and give your parents my best, please.
Yes, thank you for your presentation. And like you said, you made a statement, said you when you get the next batch, I mean, are you already contacted churches or places that we can get it going kind of fast?
So we are in contact with a community and church site, but we really want to open it up once we can fill appointments. So our planner is working hard, and once we have the vaccine secured, he's gonna open it up to the community, and so it'll be on our website, and we'll let people know how they can register.
And like you said, I don't know how much your help you have. Maybe you can get some volunteers to help you out with the next batch or something, because you got one person doing one thing. I mean, you know, it's an overload.
Well, Suffolk's actually in a good position. Through the OPAC Grant Foundation, we were actually able to hire a vaccine planner that's specific to these efforts. So that's going to take a lot off of the plate of our main emergency planner, Will Drury, who has been doing a great job. But as we know, anybody who has backup, they're going to do a little bit better and a little bit more. So we're in a good place with that.
Okay, and I want to ask you another question, because I wanted to ask that question last time you was here. I don't see anything about, like, people who have cerebral palsy or all that. Are they getting shots early, or where they line up at? People that have mental health or anything like that?
So behavioral mental health, that's the easier one. So group homes and those in behavioral health centers, they are in the 1B group, and we have received a list. And some of those are being done. There's a federal, what's it called, a federal pharmacy partnership, where they will be vaccinating, and then whatever the pharmacies can't do, the health department will pick it up. So that's one part of the question. And with cerebral palsy, that would just depend on how severe it is. So if it's someone who's in a facility, like a nursing home facility, they would have been vaccinated in the first group.
Yeah, because a lot of them can't communicate with you.
Right, so if
stuff
someone
like-
consented for them, they would have been vaccinated in the nursing home population, or
Thank-
assisted living, sorry.
All right, thank you.
Councilman Fawcett.
Thank you, Mayor. Dr. James, I appreciate you being here tonight. It's always a pleasure to have you in Suffolk. You know, this vaccine supply is not unique to just Suffolk. You see it and you hear it. It's kind of all over the countryside and all over the state. So I think that, you know, as the vaccines become more available, maybe another one comes online. I think Johnson & Johnson's relatively close. That could help facilitate getting more people vaccinated. There's been a lot of, you know, pushback on some people that won't take the vaccine, and that's all well and good. That's their decision. But I would hope that many people would take it. I've known 3 personal friends this week that have passed from COVID-19, which is not great. I mean, and it's happening not just to me, but to a lot of families each week. We had one of our family members passed yesterday. So we're looking at this as well. So I want to thank and tell you that William Drury is just phenomenal. I mean, he is phenomenal. He's working day and night to try to get people. I mean, he's taking this vaccine stuff real serious. I mean, he is out there and he's doing some oil burning late hours trying to get things lined up for the next day and get the you know, the total amounts that they can get. And I mean, he's pushing it hard. He was on Channel 10 last night, giving a little briefing on some of the differences in the Western Tidewater Regional Health District, what we've been faced with, and did a great job with that. So with that, we just keep pushing, and hopefully we can get the numbers up even more so for those that want it. And they'll just have to make that choice. But I'm not sure how that works. A choice between life or not being here could be a difference. But I thank you for being here.
Sorry for your loss.
Thank you, Doctor. Oh, I'm sorry, Councilman. You gotta get that hand up. I can't, little short guys can't see down there for.
Thank you, Dr. James, for excellent presentation. I just have one question. I understand that other areas in the Hampton Roads are utilizing the school nurses to help facilitate the deployment of the vaccine. Is that a practice that we'll be doing in the Suffolk area, or is that?
So we can look into that, but currently we are using the MRC, and Suffolk has about 200 MRC and a large amount of vaccinators. And, you know, because of our, I think, great mayor, he's calling people to continue to join, and we've actually seen a steady stream of people reaching out to volunteer to be a part of this effort. But I do think that's something we can look into as well. We're not above anybody's helping as long as they've got a certification. So that is a good point that we can add when we're looking at additional resources. Thank you.
Thank you, Dr. James. I appreciate you coming and giving us your presentation. I've got a few comments, and they're absolutely not directed at you. You're just going to be the messenger, because that's what I'm going to be. I'm going to be the messenger. I'm going to tell you briefly the daily communication that I have, you know, with my constituents in regards to vaccines and COVID-19 in general. To start with, I think to sum it up, our citizens are, for the most part, they're starving for information, literally starving for information. 95% of the citizens I have spoken to, they are not upset that they cannot get a vaccination today. They know that there are circumstances beyond your control and the health department's control. We start with the feds, we come to the states have to get it to the localities have to get it to your organization, and then it has to be dispersed. This was recognized. The Hampton Roads Planning District Commission sent a letter to the governor on January 21st. And the first paragraph in it kind of sums it up. It says, "It is clear that each health district is approaching this effort in an inconsistent manner, which is causing confusion and frustration across our region. While we understand operational flexibility, this approach, where each health district establishes its own policies, is not serving our community well." And that's exactly what it is. We know you have limited resources. The problem we run into is most individuals can't go to a website and get information. I called the local health department this morning just to double check, because I knew we had a meeting tonight, so at 8:15 this morning I called and see what the new recording was. The new recording was the same recording from yesterday, the day before yesterday, the day before that, and the day before that. We don't have any more vaccines. Well, I said we won't have any more vaccines for 2 weeks, so that gives you an idea when the recording was done. It says to call back February 4th. Well, that's tomorrow. So that recording's been on there for quite some time. Our citizens need to know more than that. That answering machine, in my feeble opinion, needs to have alternate ways of communication, being it Franklin's number, Isle of Wight's number, Southampton's number, all facilities within your district. It needs to have a daily update to keep our citizens informed, so they're not sending me, this is the number of emails I got today, not counting the phone calls. And like I said, I'm not fussing at you, because I know you got limited resources. You know, while I see other counties and municipalities having active websites, web dashboards, finally rolling out active engagement communities, they serve the Suffolk Health Department as a phone number. That's it. It says do not call until February 4th. Something's obviously wrong. When I called the health department, no one answered, and it states that they're closed. And I'm just, could you please take action to improve the current Suffolk vaccine appointment process so that it is more effective, fairer, and less cumbersome? I wanted to express concern and frustration over the manner in which communication regarding the COVID vaccine is being provided within Western Tidewater District. And I just want you to relay this information. Anybody wants to talk to me, I will spend as much time to talk about it as we can. I can't seem to find any information on when or where to get the vaccine. Frustration isn't a good enough word for the lack of a better way to help control the spread of the COVID-19 virus. And, you know, I've got 10 more. And nobody is upset because they cannot get vaccinated today. We have to find a way to disseminate information in a more effective manner. I've spoken to the city manager. We will offer any possible assets and resources we have to assist you in doing that, be it personnel. We can help you with a call center. We can help you vaccinate people. We can advertise for you to get that information out. We could do traffic control if you want to do a drive-through. I have had numerous phone calls from churches and civic leagues. We've got more locations. We could vaccinate 2,000 people tomorrow because I've got churches throughout the city. I have communities, civic leagues that have called me and say, I will offer my facility. I have spoken to Delegate Jenkins, and last week I've spoken to him on several occasions. I've got an email here that was sent to me on the 3rd. When I contacted Delegate Jenkins' office this afternoon, they told me the problem with Suffolk Public Health Department is being closed. And since it was closed, the potential is that our shots went elsewhere, better prepared to give vaccines. Now, that may not be the case, but this is the email, and that's what I got today. So, if nothing else, please inform Delegate Jenkins' office that that is not the case. It also said here that he reached out to the mayors. We as a city, with the help of the city manager and the staff and everybody here, is willing to do what we need to do. But there has to be information out. People just want to know what to expect. I've got more of my friends that went to North Carolina to get vaccines that live here. And they showed up in North Carolina, got in line, put their arm out the window and got a vaccine. And once again, I am not directing this. I know it sounds like I'm fussing at you. I am not. I want you to be the messenger. And you let us know what we need to do as an administration and everybody up here on this dais to better serve our citizens. So with that, like I said, I apologize for going, but this has been going on for a while, and hopefully tomorrow morning I'll have that many emails sitting for me to respond to, and I try to respond to every single one of them. So I do appreciate you coming tonight, and I know that you have a terrible load on your shoulders, but anything that we can do to help, we're here to help, and please relay that information to whoever's above to let them know that we have a problem. Thank you.